Hi, it's Dr. Noel Williams, Optimal Health Associates, June 2024. A little review on something called urinary tract infections and urosepsis, especially for old people. One of the things that I've noticed in the practice, both in our own patients and then a lot of the people we take care of's families, is that as people get older and they get bladder infections, they get a whole body infection, instead of just a localized infection in the bladder, because the membranes in the bladder are more fragile. The toxins can get into the bloodstream and the bacteria can get into the bloodstream, and so people get changes in cognition, mood and memory. So they get disoriented and they get very, very sick, and that can be just their presenting sign. But of just a bladder infection, and since this is so common, it seems to me that perhaps we've forgotten how to treat it in mainstream medicine and the root cause. So the root cause of bladder infections in women over time is a change in blood flow to the bladder, and a change in the tension of the urethral sphincter. So what happens and why? Why does it happen? It happens because hormone levels fall. And with hormone levels falling, oxygenation falls. And when oxygenation falls in the bladder, the normal bladder bacteria, because the bladder is not a sterile environment, it has its own species of acidophilus in it, just like the vagina. And when you don't have those species of acidophilus, you're more susceptible to infection. The interior surface of the bladder is more fragile, so things can break into the body more easily, and people can get a lot sicker. And again, they may not have any burning with urination or urgency or frequency, they just suddenly get very disoriented, and a lot of older people die of this. And it can be very debilitating for them, and it also leads to falls and all kinds of things. So if you have a friend or a relative, more likely, or yourself having this problem, think it's very straightforward to fix. We need to re-estrogenize the bladder, and the vagina is key. It's very safe and very straightforward to do. We can have prophylactic measures in terms of making the urine more alkalotic. We can be on supplements that will help the immune system and boost the immune system. But the key thing is re-estrogenizing the vagina, and you can do that very safely, even if you were a breast cancer patient or you've had a heart attack, because there's things that only work in the vagina, so you don't have to worry about systemic absorption to the body. So if you know someone or have a family member who's having chronic bladder infections and they're older, that's a really important thing to know. It is something you can get fixed. Talk to your gynecologist or your primary care doctor about appropriate ways to do estrogen replacement therapy locally to correct this. And of course, at Optimal Health Associates, that is something we're very adept at doing if your own provider doesn't feel comfortable doing that. It's just a really easy thing for people, and I don't know why we've forgotten this, because it seems like we have in medicine, and something so simple doesn't need to be ignored. So anyway, take care, and just a little vignette on urinary tract infection in older people. In girls, not in boys. Boys are much less likely to have that happen. Anyway, take care and good night.